In this video, we're gonna be talking about shoulder impingement, right? So what's going on, why it's going on, and how to address it. So what's up, guys? My name is Dr. Joey Rosie. I'm a physiotherapist, strength coach, and the founder of Linear Performance. Today with me, I have Ben Cockshott, who is the founder of Seneca Training Systems. So Ben here is a performance coach. And Ben was reaching out to me because he has an athlete of his that is having some pain and some issues with shoulder impingement, especially with overhead movements. So today what we're going to talk about, and we're going to use him for demonstration purposes because he moves very well, is we're going to talk about what's going on, why it's happening, and really how to address it. So first things first, what is shoulder impingement? And the easiest way to say it is shoulder impingement is when structures in the shoulder essentially get impinged anytime you're raising your arm overhead. Now, I just want to make a quick note that impingement will occur naturally. There will always have some level of impingement. When it becomes an issue is when there's excessive impingement to the point where it really starts creating dysfunctions, limitations, and inhibiting you from doing the things that you want to do. All right, so now that we understand what's going on, let's talk a little bit about why you could be having shoulder impingement. Now, if we're taking a look at this shoulder girdle complex, the shoulder girdle complex really has a few joints that really are in play. So we have the scapula or the shoulder blade, and then we have the glenohumeral joint or the traditional shoulder, if you will. And the thing comes is what comes first, or where's the issue come from? The chicken or the egg? Is it coming from an issue of the scapula not doing its role, therefore the glenohumeral joint is really having to take over more, or is the glenohumeral joint not really doing its role that it needs to either? So really what we want to do is figure out what's going on and why this typically occurs. So what we're going to do is I'm going to have him turn around. So traditionally, when looking at the body and how it moves, everything when it comes to the shoulder is going to move first and foremost from the scapula or the shoulder blade. And then that is going to actually dictate the shoulder itself. So 9 times out of 10, shoulder impingement is going to occur from an issue here, therefore that your body is trying to compensate at the glenohumeral joint. So first and foremost, go ahead and go into an overhead, you can just do it without the bar, into an overhead position. So you see how we're getting some movement, and then come on down. See how we're getting some movement here in the shoulder blades, and see how they're moving around. We see some movement going on. Well, let's break down this movement as it happens, because it happens in essentially 4 distinct stages. So first and foremost is we get protraction. Protraction occurs when the shoulder blades come up against the rib cage. Okay, so first and foremost, we're going to have that occur up. Then 2, we're going to have where the shoulder blades actually come outward a little bit. And that's going to create some tension in some other muscles and such. So from here, then we're going to have, number 3, we get this upward rotation where you come all the way up. So you see how the shoulder blade just wraps around. We get that to occur. And then last but not least, if we're here, the shoulder blade actually has to do what's called a posterior tilt. And that way we take the stress here off and then it drops down from here. So actually going up. So what happens here, when there's a limitation here, what's happening is the shoulder blade, especially this bottom part, is almost winging off some, and that's where we're going to get that lack of that limitation. So what I'm going to have you do is actually do a half-quarter turn here, so right there. So the posterior tilt, or lack thereof, is going to occur when the shoulder blade is down like this and not here, right? And we really need to get that dropping, that posterior movement of the scapula to give us as much breathing room here in the front. When we don't, when it's more of this rotated in like this, that's when we start to get a lot of that impingement, okay? So impingement itself, at the end of the day, is going to be, yes, we're getting some structures impinged. Why? Okay, why? It becomes a limitation of one of those 4 stages. A lack of protraction, abduction, upward rotation, or a posterior tilt. Now what we got to think about, how do we address it? So we're going to walk through each and every way how to address at each one of those 4 stages. Now when looking at how to address muscles at each individual stage, right? All of this is going to occur from muscles, right? And at the end of the day, we need to have 3 things at each stage. We need to have the range of motion, right? We need to have the strength and then the coordination, right? So at the end of the day, are these muscles What muscles are tight or could be tight, what muscles are weak or could be weak, and what muscles are not coordinated properly. Where do we not have a proper balance between those? And we can have limitations at each individual stage that is going to dictate how we truly address it, because at the end of the day, addressing it is really going to come down to focusing on what muscles are tight, what muscles are weak, and how we get the coordination at each stage along the way into that entire overhead movement. And if we can address those things, we are actually going to be able to eliminate and significantly reduce all of the pain or limitations that you could be having. So let's go one by one through each one. So when it comes to protraction, right? So protraction is where the scapula is going to come up against the rib cage, right? Now, a couple ways that we're going to see or a way to tell if somebody doesn't have protraction. So if you just keep your arms down, so you have to have you have to be able to see this from behind, and it works significantly better without a shirt on. So when looking at somebody, especially through a video, what you want to look for, which is going to give you all the information, is going to be shadows, right? Do we see shadows? Because shadows are going to really dictate how much of like space is in between. Now here, just relax. So what I can do, I can actually come in here and get my fingers underneath, right? And that tells me that we do not have a complete protraction against the ribs. Now, if I come here, there's a little bit more here, less there, not so much here, right? So protraction wise, he's got more control up here than he does here, okay? Now, let's say you're not in person. Let's say you're not, putting your hands on somebody, or let's say you can't put your hands on yourself, right? But what you can do is you take a video of yourself and take a look. So that's where shadows and things come into play. So looking here at shadows, do we see shadows anywhere? Anytime we see a lot of shadows, that is going to indicate that we are having that shoulder blade is going to be coming away from the rib cage. That's going to signify that. So in this case, if we have the muscles that are here away from the rib cage, what muscles are going to be tight, and then what muscles are going to be weak, and then where do we have to have the coordination? So first and foremost, what muscles could be tight, right? We're going to be looking at rhomboids here, which are these muscles that come down in a fiber orientation like this, or the mid-traps. Those are most commonly going to be the ones that are the most tight, that are going to limit protraction. Okay, the pecs can play a big role as well. However, more so if the pecs are completely fine, then this is where we'll see the limitation. Now, what's going to be weak, right? It's going to be the muscle that lies just underneath the shoulder blade. That's going to be your serratus anterior. Okay, so if that's going to be the muscle that pulls it straight up against the rib cage. As far as coordination comes into play, we need to have a coordinated effort of making sure that there is an equal balance between the serratus pulling it forward, the rhomboids, mid-traps pulling it out, and then having a coordination with the pecs, right? Typically in this stage, and somebody's just quiet and sitting or standing, they're not moving, if we can address the tight and the weak muscles, that's going to take care of it. So number two, if we're moving on to abduction, and that's going to be where naturally the shoulder blade should not sit straight down, right? It should actually be up at a slight angle, right? About a 7-8 degree angle. Now the next thing that should occur, we should see the shoulder blades come out some, right? They should just come out like this, okay? Now, that's going to be abduction. So first and foremost, let's go back, same thing. What could be tight, what could be weak, and what about the coordination? Now, as far as what muscles are going to be tight or could be tight here, right? That's where we're really looking at the the rhomboids. If we're looking at on the limited ability to come out here, it's going to be the rhomboids the rhomboids in the mid traps, right? If it's limiting us from coming out here, out like that, those muscles that are pull the shoulder blade inward are typically going to be tight. So what's going to be weak? Same thing. It's actually going to be the serratus anterior again. So that same muscle actually comes out and brings the shoulder blade up, first against the rib cage and then out. Okay. Now, as far as coordination, same thing with coordination. Do we have a coordinated effort? Do we have a balance between these two? What's going to happen here is if we have too much pull one way or another, that's where we're going to get the limitation. So what we could see here is where it just sort of wings off here, and we're going to get a winging up here like this on this inside, and that's going to signify that we have stronger rhomboids mid-trap and weaker serratus anterior. All right, so continuing on with abduction. There's a couple things that can also have a coordination issue, right? And first and foremost is with abducting the shoulder blades around. Now, where we could have a decreased coordination or even a tight muscle in this instance is actually the pec major. So the pec major will, you can turn right here. So say these muscles are tight and it's not willing to come here, it's actually going to be what pulls those that scapula up and around like that, right? And that's just simply from a tight pec or an overactive pec. So in this case, we could have either pulling forward or pushing out, right? So is it pulling it out or pushing it out? So turn around. So are we from here in the front, are we pulling? Or from here in the back, are we pushing? And the best way that I can think to explain this is if you have, a regular car versus a sports car. Okay, we're much stronger pushing, right? If you think about a sports car, it's always rear wheel drive where it's pushing, where if you're looking for more fuel economy, you're definitely more front wheel and you're looking at pulling along, right? Now in this case, if we're looking for power, if we're looking for performance, if we're looking to move well, we want to be pushing from behind. We want to definitely be using these muscles from behind. That's going to come into play later, because if we prematurely start using these muscles here in the front to pull, we're not going to be able to use them too well later when we need them in the next stage. Then third, what we're looking at is going to be that upward rotation. When it comes to upward rotation, that's where we need to have first the protraction, then the abduction, and then it rotates upward, right? So just raise your arms straight up. So see, if we're looking at the shoulder blade, see how we see these lines here? That's that same border that was once here that rotated upward here like this. Now, as you can see, go back up nice and slow. Come on down nice and slow. All right, see how we see all this movement? Do it one more time going up. See how it's coming up, 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 and we just watch this line. So we're getting that full upward rotation here. Okay, now that's that third stage. Okay, so the third stage here is what muscles could be tight, what could be weak, and then what could we be limited in coordination for. Continuing on with upward rotation, right? We need that upward rotation movement to occur. Now this is where I would say the bulk of people really do have the greatest limitation and start having those complaints with getting into any of those overhead movements, okay? Now, at this point, if your scapula are already abducted out, we got some muscles that naturally have more stretch on them and some that are naturally more tight and some that have a better line of pull to move better. So what we need to do is make sure that all the right muscles have enough length and all the muscles have enough strength, and then to coordinate them properly. So here what we can have is we can have tight upper traps, which are going to actually pull the shoulder blades not only out but upward and over. We can have tight lower traps, which never allows us to fully get to that upward rotation movement. We can even have tight rhomboids mid-traps that never fully get us to that outward movement, because we're going to continue to go outward as we go into that upward rotation. We can even have the weak serratus anterior to really help that with that upward rotation. Now what's really cool about this, upward rotation occurs from a force couple. A force couple occurs when you have two opposing muscle actions that of equal opposing muscle actions that create a brand new motion. So in this case, it occurs with the trapezius or the traps. So you have the upper, the middle, and the lower fibers, and then you have the serratus fibers that go this way. So you have one muscle that pulls essentially inward and one that pulls outward. By having a coordinated effort between those, that's actually where we get the upward rotation. So here is actually where I find the bulk of people really have the greatest limitation, is having an imbalance, right? Whether the upper traps are way too strong relative to their lower traps, and therefore their upper traps are too strong relative to the serratus anterior. And that's what changes the entire amount of that coordinated effort needing that to get overhead. Now, if we don't have this part, we're definitely not going to get the last part, and that's that posterior tipping, that posterior tilt of the scapula. Now, that is going to occur, so go ahead and go all the way to overhead position. That's going to occur here that you'll see with somebody who, actually turn, is they get to this point but never here, right? And when they get to here and not there, most of the time, 9 times out of 10, it's because the shoulder blade is here, not giving them enough room. So if we actually just crank the shoulder back, all you're going to do, and that's going to further create impingement. And this is where most people end up complaining about the most. It's usually those end range, high end movements. But the issue that most people have is not just this end range movement. It's they don't have that because they don't have the upward rotation control to get to that movement. So from here, what we have next is that posterior tip. That posterior tipping or tilt that has to occur like this. And so what tight muscles are going to play the greatest effect here? Well, the tight muscles here are going to be the pec minor. So if we turn, the pec minor runs from here to here. And if that is tight, it's going to tip you down here. So if you can imagine, I was constantly pulling him here. Now, if he tried to reach up, see, it's hard, right? He's having difficulty doing that. But what we do a lot of times, we see barbell athletes try to force themselves through it. They try to push through it. And that's where a lot of those impingement pains and things come from. So what we need to do is see what muscle's tight, what could be weak, and how do we get that coordinated effort. So in this case, tight, that's going to be that pec minor. Okay, weak is actually, again, going to be that serratus anterior. If I haven't convinced you at this point that the serratus anterior is probably the most important muscle when it comes to the shoulder and getting overhead, hopefully this does, right? So the serratus anterior, if we're looking here, hold that up. If this is the scapula, the serratus anterior has 3 essentially fibers, but we can even break it into an upper and lower. The upper fibers do the greatest effect on protracting and abducting out. Those lower fibers do the most on that posterior tipping or that posterior tilt. And that's where really having an arm where you come here like this and getting that to where you completely open that up here. Now, the quickest way to test this and come here is to see if you're ever going to get to that overhead position. Come here like this and just go into that 90-90. Do you have this full range here? If so, that's good. That shows that we have that posterior tipping. Now what you got to do is go straight up with that. And did we lose it? Did it come forward here? Did we lose it anywhere? If so, if we don't have it all the way up here at this end range here, then that's showing us that we don't have that posterior tipping as well. Now that's just for the strength and, the tight muscles and weak muscles. Last but not least, it really comes down to the coordinated effort. Now I can tell you, if you get through all those first 3 stages, this last one pretty much takes care of itself as far as a coordination effort. It really does. But what we have here is really going to be more of where the deltoid rotator cuff force couple kind of work together. And again, a force couple, if we come here, is when 2 opposing muscles create a new motion. And in this scenario, if we look at the deltoid, which is this muscle here, right? If you bend your arm, come up 90 degrees, your deltoid is the primary mover here. The rotator cuff, when it works as a unit, helps hold the glenohumeral joint, right, or the humerus in the socket, right? Its main job is to hold it here. When these 2 muscles are working together, the stronger deltoid pulls up, the weaker rotator cuff pulls the shoulder down. So at that end range, if we have good protraction, if we have good abduction, good upward rotation, the last component is now looking into this component, or in this joint here, and that's the glenohumeral joint. And that's where we have to then decipher the deltoid versus the rotator cuff. And do we have an equal and opposite balance there? If so, 9 times out of 10, you're gonna get rid of all the pain, all the limitations, be able to continue working on your performance and enjoying your life to the fullest. You know, let's do a quick assessment on Ben here. So real quick, if we're looking, let's say I'm not here in person and I'm just using, you know, footage that he sends me, you know, and let's say he was one of my clients, right? If I'm not here in person, it's a little bit harder, so I gotta look for shadows. One thing we see here, you can see some shadows here and here, right? But more so, the next thing, with the shadow tells us what angle is the shoulder blade at. And if you can't fully tell, that's okay. What we want to do is have you move a little bit. Come down a little bit more and then come up. All right, so see, like actually lift the thing up or down and come down. So see here how watch him come down. So we have this line here and then we're gonna follow. So there, all right, just relax. What we see here, right, and we can see really nice and easy on him, is see he's actually in what we call a downward rotation. So he's actually here in this downward rotated position. So if we're here, naturally we would have a neutral position, and neutral is not going to be straight but actually a slight upward, right? He is actually downward. So then we got to think, what muscles are tight, what are weak, what are coordinating, right? So in this case, his upper traps, and they come down like this, these are actually going to get an excess stretch, okay? And it's very common that I'll see with lifters where they get a lot of tension up in here, okay? Now, one of the ways we can focus on that tension, decreasing that, is there's a whole array of things you can do. You do dry needling, grafting, massage, manipulation, body tempering, you name it. There's a lot of things you can help with decreasing that tone, right? But at the end of the day, if these are overly stretched, we actually have to get these stronger without disrupting the coordination later that we need for that full overhead movement and getting these too strong relative to the lower traps. Now, if he goes to go ahead and push, good. At this top end position, if we hold this like a static position, this is phenomenal. This looks beautiful. It looks textbook, okay? We have good upward rotation, looks relatively symmetrical, right? By the way, real quick, if everything is not 100% symmetrical, that's okay. Everything does not have to be 100% symmetrical. We are going to have a little bit of variability person to person and even side to side. So the quickest thing I like to say is, if it ain't there, it ain't, right? If you can't immediately tell that something's wrong or something looks different, it's not a big enough factor. So in this case, his end range is looking fairly good, right? Really good, almost textbook. And then his starting range doesn't necessarily look optimal, okay? Does it mean anything's wrong? No, it doesn't. Just he's not moving optimally or starting optimally. So come on down. All right, so as you see him come back down, right, another thing we're doing, actually come back up. When we come down, what we also want to see, and it's actually easier, I find, especially in the beginning, learning and watching movement, it's easier to see it come down than it is to watch it come up. Because the way it comes down and controls actually gives us more insight of how we're actually going to lift the arm up. So come down nice and slow. And we're looking for symmetry each side, and stop there, and see how we're starting to see a little bit more shadows here. That's giving us an indication that in this point, we're losing a little bit of that stability and that combination side to side. So in here, right in this area, this is during that abduction stage. So here we have the serratus anterior pushing here, right, from the scapula, and then we have the rhomboids and mid-traps pulling in. Now from the glenohumeral joint here, we have the serratus anterior pushing, and we have the deltoid, we have the pecs, and we have the rotator cuff pulling. Right, between the two, this should always be stronger. Many times we see compensations here. One way you'll see here that if somebody's constantly compensating here is if we have a lot of hypertrophy up here in this anterior delt relative to their control here and hypertrophy here. So if this is significantly bigger relative to this, then chances are they're doing a lot more pulling from back here when it comes to the shoulder than pushing, right? That's gonna be our first indication right there. All right, so keep coming on down. So same thing, we're just constantly looking for where those shadows could be and then how they're moving. Do we see any symmetry? Is it there? Do we see anything wonky happen? Remember, if it ain't there, it ain't. And then how we're gonna address it. So in this case, if I was gonna take a look at him, come all the way down. So, are you resting there? Mm-hmm. All right, so in this case, right, if I look here, right, everything looks good, right? Now, granted, I'm with him, so I'm touching. Tone feels, relatively healthy. Don't see anything, don't feel anything. Here, I would expect actually more, muscle mass in his infraspinatus here than I would relative to his anterior delts up here, right? That would tell me that he's using a lot more pulling here than pushing from behind, right? So a couple things that I would do with him, go ahead and actually go up halfway. Good. And a quick way to do this is you can test to see, have somebody hold something up here, and it doesn't have to have any weight here. See what starts to fatigue first. Are we starting to feel a lot of pressure here? And what sort of happens here? Are we getting this to where we're really wrapping around? Do we notice, if we hold this for 10, 15, 20 seconds, do we notice shadows start to get bigger? Do we notice compensations here, but no real movement? If so, that's gonna show us where the weaker link is. All too often, now quick note, many athletes can do something 1 time, 2 times, 3 times, 4 times. It becomes when they do it 30, 40, 100 times, 20 times with load, right? And it's not that they're weak right away. It's that their fatigability catches up with them, and then the body looks at compensating throughout. That's also the other component of what we need to find that your limitation is in, and then truly just going and addressing. At the end of the day, addressing things is actually the easy part. The hard part is really fully assessing how somebody's moving, why they're moving that way, and then once we know the why, we can always add the what they need to do, how to truly fix it. Come on down. All right, so with him, he's a little weaker here relative to here. Okay, so one thing I would have him do is a face pull. Face pulls are my absolute favorite because they take the scapula through the entire range that we would need in the correct movement patterns that the scapula and the glenohumeral joint are gonna need for any and all overhead movements. Because if you can master that and hold with good control, then I promise you're gonna have significantly more optimal control, position, and power in all of those overhead positions. All right, so one of the exercises that I'm gonna have him do, or that I would have him do, is a face pull. Now, first and foremost, face pull, like I said, it's one of my favorite exercises, and we can use it so many ways to manipulate so many little things here at the shoulder that are gonna play a huge, huge effort and emphasis later on. Now, with him in his case, we actually wanna kinda keep the band really at eye level. So go ahead. So what he's gonna do, he's gonna pull and rotate his arms at the same time. At the end position, see what we want is we want this good 90-90 position here, right? He's able to hold this, and then we also wanna make sure that he's doing good here, but let's actually do it where most people end up, come on back here, and their elbows get too far behind, they can't come here, or they hold there and they try to keep coming back, and there's nowhere else to go, right? So what you wanna do, come back to that position, back, drive your elbows forward, there. Now, what we should do is actually his scapula really released, right? It relaxed a little bit and it came out in a better set position, and we should feel a lot of burning in here. How's that feel back there? Good. Really feel it burning? Mm-hmm. How's it feel though? Should feel nice and stable here. Yeah. Right? Now, so this is a great starting point. Once you master this point, what we're gonna do is we're gonna progress a little bit. So relax a minute, and we're gonna do it again. Come back to that same position. Hold. So right there. Now what he's gonna do is he's gonna actually go through the range of an overhead press, any of those overhead positions and movements, right? And he's gonna hold that there. Now, at here, if we at any point see his arm either come forward, rotate inward, rotate outward, or anything like that, that's gonna be our limitation. So come on down. So he would just work in this point and then come up as far as he can control. Maybe it's there, maybe it's not, maybe it's further. He would want to go as far as he can control here, and then come straight on up, 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 a little bit more. So what you're going to do now, come from here, down a little bit, and then back. Just back like this, like a Y. And this would allow us to really maintain that position and then bias the lower fibers of the traps, right? So we should really feel it down here. Now, if we end up feeling it too much up here, that right there is going to show us we have a compensation of the traps alone. Remember, we're looking for coordination between the serratus anterior and the trapezius. Then we need to make sure we have a balance of the upper versus the lower traps in just that component alone.
All right, so what I see commonly with my athletes and where they think they're completing movement is if we're pressing, right, but I'm out in front, to get it completed, I'm going to change my body positioning so that way I'm overhead and getting that lockout. But then we're running into the problems of, are the proper muscles completing the movement, or are we just moving for the sake of moving, meaning I'm getting it to where it's supposed to be, not how it needs to get there. All right, so 3 common things that I see with my athletes are being too narrow with their grip, then trying to adjust possibly out too wide, and then when we're overhead, breaking at that mid-thoracic to complete overhead range of motion versus being strong and stacked. All right, so when people are too narrow, what you'll see here is that overactive pec, right? We're playing into where our issue is. The other thing that we'll see is if we go too wide, we're trying to create space. We're not necessarily tight here, but we're going to get that rounding of the back, so that way we can complete the motion overhead. And then we see a combo of the two, right? We're going to see a fairly neutral grip, so not narrow, not wide, but once we're overhead, because we're actually pressing slightly forward, we break at that mid-thoracic, we get that rib cage or that Prager belly look because we're not engaging through the trunk, right? Yeah, and then we throw that head forward because that's how we finish the range of motion.
So how do I fix it?
All right, so when it comes to fixing this motion, we're going to start off by making sure our rib cage and pelvis are working as a unit, right? We're going to brace our trunk, our whole core. That's not just the abs, but you're going to physically press out into if I have fingers right here, you're bracing tight, pressing out into it. We're then going to set our front rack where our elbows are slightly forward. We're squeezing the biceps, our shoulder blades are set back and down. And from here, as we start to press up over, the head gets out of the way, but we don't go backwards. We're going straight up towards the ceiling. So then when we finish, we're stacking our joints from the wrists, we have the elbow, our shoulder, and our whole spine because our rib cage and pelvis are a unit. Good fix there.
All right, guys, I know this is a really in-depth tutorial talking about shoulder impingement, what could be going wrong, why it's happening, really how to address it, right? And the thing is, it's very complex, but it can be simple at the same time, right? The simplicity comes once you truly understand why something is happening. Really figuring out how to address it really becomes that much more simple. All too often, people don't fully understand that why, and that's what we really want to put together today. So if you have any questions, don't hesitate to reach out to either Ben or myself. I'll put the links below. But if you could do me the utmost favor, go ahead and subscribe to the channel, like, comment, and do your thing. I'll see you in the next one.
See you guys.